can do this. No. Come on, Mia. You graduated top of your class. You were president of Beta Pi. You started the largest vegan movement in any university history. Landing your first job, 500 miles north of home. It's easy peasy. You put in your 12 months, apply again back in the city, and this bump in the road will just be forgotten. You got this. You got this. You got this. Hello? Hello? Is anybody there?
Who are you?
Mia Gill.
The new hire. You're late. We don't tolerate tardiness around here. Every second counts when you're saving lives. And we're shorthanded as it is. Put it on.
Oh, okay.
Come on, let's go.
500 cc IV push. Now. He's losing too much blood. He's going too deep to close. He needs surgery now.
Chopper is at least 30 minutes away. We need to preserve as much cardiac activity as possible. Like, how should we proceed?
I vote we cut the limb and cauterize.
Okay, let's ice him. Grab bags of ice and we'll pack them all around him. Actually, you're right. He's losing too much blood. We'll need to amputate. Hand me the saw. Okay, hold his leg. Ready?
Oh my God, we got our good guys.
You know what we should do next time is actually we should maybe think of I don't know, an eyeball injury or something like that. What do you think?
An eyeball injury! My grandma's got a fake one at her house on top of her dresser. We could use that!
You're awesome. You're awesome. Hi. Dr. Campbell, welcome to Spry River.
Thanks. Great to be here.
Absolutely.
Just gonna stand there, or do you wanna grab a garbage bag, broom, something?
What the hell was that all about?
Spry River Hospital initiation. Gets me every time. Highlight of my year.
You guys must be pretty desperate for some laughs around here. Where are the actual patients?
Well, they're around. Depends who you're looking for.
Who are you?
I'm Whopper.
Whopper.
Yep. Nobody catches a northern pike quite like me. Hey, on Saturday we're going over to Sandy's barn and we're gonna fry up and swap some of our catch from this week. Might get a little bit rowdy, but don't worry, they don't mean any harm. You should come on by.
Yeah, thanks. I'll think about it. But I should probably go check in or something with someone who's actually in charge around here.
That'd be Margie. She's the boss lady.
Okay, I should go find her.
You can say no to her. Newbies.
Well, that's her list. You're late.
Oh, I was just helping clean up the OR.
The sick and dying have no patience for the tardy.
I'm sorry.
Here's your patient list for the day.
32A, 33, 34B, 35A and B, and 36A, 37A and B, 38A, 39B, 40A and B. All of these are mine?
Yes?
You have cardiac patients with psychiatric patients and a pregnant lady with a surgical patient. I don't understand why.
It's not up to you to determine the whys. It's up to you to get your patients ready for the day.
Oh my God, Mr. Ratzlaff, are you okay?
Surroundings check. Check breathing.
Oh, I'm okay, dear.
Mr. Ratzlaff, I need to check your pupils.
I'm really okay. This happens at least 3 times a day.
Well, you're really lucky that you haven't injured other parts of your body from falling. You think you're okay to get up? Okay. There you go. Let's get you all covered up. Okay. Your breakfast is already set up for you, so I'm just gonna add your meds on here.
Oh, good.
There you go. You let me know if you need anything else, Mr. Ratzlaff, okay?
Alrighty.
Okay.
Thank you, dear.
You're welcome. Good morning, Mrs. Fitz.
I'm ready to push.
What?
Set me up. I need to push.
Okay. Wait. Just wait. Keep breathing. Okay. Take a deep breath. You said you need to push? Okay. Mrs. Fitz, is this your first baby? Well, generally, in order for a baby to come out, your vagina has to expand to about 10 centimeters. And, well, yours is at 2. Okay, so we have a bit of time. Let's get you comfortable and let's practice some relaxation. Okay?
I feel relaxed when I ride a horse.
Okay, why don't you show me what that would look like?
Alrighty. This is what you do.
Okay. Great job. Keep practicing that relaxation. And I'll be back, okay? Mrs. Perron, I'm Mia. I'll be your nurse.
Mia! I've been waiting in the store for you for an hour. I really want an ice cream.
You do? Well, I don't have any ice cream, but why don't we see if we've got something else that comes kind of close? How about the yogurt? It's cool and creamy.
I prefer chocolate mint, but I guess I'll try this. I'm done.
Mrs. Perron, when was the last time you had a BM? Bowel movement? Pooped. When was the last time you pooped?
Oh dear, I just did.
Oh, you just did. Well, it says here on the chart that you haven't gone in 11 days. To be disimpacted if no prior bowel movement has occurred by the 12th day. Why don't you have a drink of water and I'll go get ready for something special.
Mia, Mr. Duff and Miss Casey require their meds before they eat, and their dinner is getting cold.
Okay.
Do you know where my patient is?
Mia, finding Mrs. Raymer is now your top priority. Get on it.
Do this.
When I look upon his face, the one who who saved me by his grace.
Mrs. Raymer,
Yes?
what are you doing in here?
I've lost my prayer cap. I can't stand in front of the Lord and be received without my prayer cap. My mother, my sisters, my brothers, my father, they would all shake their heads in shame.
There, Mrs. Raymer. It's okay. I'll help you find it. We'll find it.
We will.
We can't let any shame come your way. Now, what was that song you were singing?
When I look upon his face, the one who saved me by his grace. Hungry? I'll take care of you, honey.
And I you.
Oh.